So, how is your pelvic floor actually affecting your bladder habits, or how is your bladder affecting your pelvic floor? There's a couple different ways. So, how does your pelvic floor affect your bladder habits? So, one, if you hold your bladder too long, this is like a balloon, remember? And it will stretch like a balloon. Think about what happens to a balloon that's blown up too big for too long. It can get overstretched. Not only that, but think about as it's overstretched, it's heavy. It can start to fall. So, not only do you have that prolapse and that descend of that bladder, but if you look in the other video, I was talking about how it falls forward, it's more difficult to empty. So, making sure that you go to the bathroom regularly and not allowing that overstretch to happen, concluding in possibly a prolapse, it definitely can make a big difference. So, the second way your pelvic floor can actually be affected or can affect your bladder emptying is if they're overactive. So, if your muscles, remember there's a bowl, there's the big bowl, and the pelvic floor is the muscles at the bottom. If those muscles are tight or are overactive, it could be squeezing on this urethra. So, it's going to be more difficult for the urine to empty and evacuate. So, having those muscles pliable and functioning correctly is going to help aid in that actual emptying of your bladder. So, the third is actually super common, and that a lot of women suffer with chronic UTIs, so urinary tract infections. So, but the catch is sometimes this urinary tract infection has been tested and cultured, and it's not actually an infection. Why is this happening? Well, when you have pelvic overactivity, surprisingly enough, that pelvic tightness can actually mimic the same symptoms as a urinary tract infection. UTIs can be diagnosed by doing a urinary culture, they test it, boom, you have a UTI, you get antibiotics, the symptoms go away. What are the symptoms of a UTI? Typically, it's urgency, frequency, lower abdominal pain, and a burning sensation. Um, you know what else mimics that? Pelvic pain. So when women get a UTI and they're like, I got it cultured, it's not a UTI, and they're still feeling that sensation, the pelvic floor muscles might just be overactive. So by working those muscles and relaxing those muscles, those symptoms typically will relieve on their own. I actually personally have experienced this. I've had urinary tract like infection symptoms, and I'm going, okay, so there's a tool that you can do your own manual therapy. I'll do my tool, boom, symptoms go away. All in all, my pelvic floor muscles were just overactive from whether stress or whatnot. Mine's triggered by stress, but who knows? Whatever your situation may be, but that's actually a common occurrence of hidden UTIs that are actually pelvic pain. So the fourth way the bladder can actually be affected is if you have a C-section or a hysterectomy scar. What will happen with those is it can decrease your awareness, your bladder awareness, and decrease the sensation of the bladder because those scars will actually adhere down. So I always like to say, take a look at the scar. Is it moving? Is it pliable? Can you move it? Is it stuck? If it's stuck, it could actually possibly be adhering to that bladder, affecting the bladder function and the bladder sensation. So, there's ways to manipulate that scar and keep it moving. But that's definitely something to take a look at.
So let's review the 4 factors that can increase bladder urgency and or affect your bladder habits. So the first was bladder overfilling. Basically, that bladder overfilling can sometimes cause a bladder prolapse over time. This can cause a decrease in sensation in the bladder. The second is pelvic floor muscle tightness or overactivity. This can increase the difficulty in emptying the bladder. This will happen basically when the muscles are unable to fully relax to effectively empty the urine. Number 3 is UTI-like symptoms. It basically can mimic pelvic muscle overactivity and or pelvic pain. So the spasm sensation, if no urinary tract infection is present, is basically a muscle spasm of the pelvic floor muscles and can be addressed with things like manual therapy techniques, things like that. The fourth is abdominal scarring. That abdominal scarring can adhere down to the bladder depending on where it's located. So if it's located right over the bladder, it can decrease the sensation actually to the bladder if there is some sort of adherence.
If you haven't already, please subscribe to the channel and like this video, because otherwise you're not going to get notified whenever I release another video. So make sure you do those things.